Welcome back to East Texas Live on KETK. Joining us now is Dr. Mac Segusa with Tyler Oral Facial Surgery. Now that we're in June and it's Oral Health Month, we have him here with us today. So first off, sir, how are you doing today?
Oh, doing great. We're back in the business and feel like we are going full speed again.
All right, so thank you. So when the Texas governor announced the order to limit medical and dental practices to emergencies only in March, many practices decided to temporarily close. So what did your practice do during this time?
Well, we immediately had to cancel many of the non-urgent patients, and we had to limit just the emergency patients only, which pretty much opened up a practice appointment schedule. But we felt like we need to do that because there are a lot of people in this area with present with a different kind of infection other than COVID. So we had to be available for those patients. So we pretty much stay open whole time and are able to accommodate those patients. I was surprised to see as many patients we're able to see during those time and accommodate them really quickly because we had such open schedule, so we could take care of those patients real quickly. But we stayed open the whole time.
Yes, sir. And one thing I'm hearing from you is that you're really passionate about your patients. So what new measures did you implement in order to prevent the spread of COVID-19 for your patients and your staff?
Yes, we immediately implementing the mandatory mask protocol for everybody come through here, as well as my staff. Also start doing the temperature check, and also have a questionnaires where a patient has to ask certain questions such as fever, cough, change of smell, and recent travel outside of state. And also change the seating arrangement in such a way that they'll be seating, at least 6 feet apart. And also, for the surgical patient and the family, we ask patient's family to wait in the car instead of in the office. So we did best as I can to keep people apart, as well as to prevent spread by wearing the mask. And obviously, our staff had to wear a mask as well.
Yes, sir. So one of the things, in the beginning we talked about what happened in March, but now we're fast forwarding to now in June. So since the governor's order to resume normal practice, how have things been going inside your practice with all the new things you just told me about?
Things been going pretty good. We kind of got to practice this social distancing and other preventive protocol for a month and a half, so we all kind of got used to it. And all the patients been very accommodating to our recommendations. We obviously call a lot of patients whose surgery's been delayed, and they're really happy to come back and get procedure done. So we've been, our office visit has been picking up pretty quickly over the last few weeks, and everybody's been doing well and staying healthy.
Yes, sir. Yes, sir. And for the people at home that would want to come in and get a procedure, what is the most common service you do during this time of the year?
In the summertime, obviously most kids want to get things done when they're out of school. So most common thing we do in the summertime, wisdom teeth extractions. And oftentimes we also do corrective jaw surgeries. Those are the two common procedures we do at summertimes.
And sir, for anyone wanting to find more information on that quickly, where could we, is there like a website that we could go to and find all that?
Yes, we do have a website, TylerOralSurgery.com. We are adding a new doctor starting in July. So we're going to have 4 doctors starting in July. So we should be able to accommodate everybody who wants to be seen as quick as possible so they can get things done before school start, hopefully school start in August.
Thank you so much for your time, sir. I appreciate it.
Yes, sir. Thank you very much.